My name is Amelia Benefiel, and I'm an advanced clinician and registered nurse in the emergency department at Sharp Memorial Hospital in San Diego, California. Every emergency medicine provider knows that flu season can mean that the emergency department sees a notably higher number of patients compared to other times of the year. To worsen the blow, these patients are oftentimes sicker and require more testing and ultimately more time spent in the emergency department. This usually leads to higher wait times and lower patient satisfaction scores. It also leads to worsened stress on the emergency department nurses and the ancillary staff that work with us. We can't do much about having a high census and higher patient acuity, but what we can do something about is how we respond to it. Sharp Healthcare's goal is to be the best place to work, the best place to practice medicine, and the best place to receive care. But unfortunately, during flu season, this is something we get away from. To improve our current situation, Sharp Memorial Emergency Department's strategic goal for flu season should be focused on maintaining satisfactory wait times during high census. One way to better combat the high census, the staffing for nurses needs to account for an increased volume of patients and potential nurse sick calls. Regardless of high census, California law regulates the number of emergency department patients a nurse can care for at any given time, thus limiting the number of patients that can actively receive care secondary to nursing staff. Adding to the limit of nursing, many staff and their families often fall ill during this time, contributing to sick calls occurring more often. Having additional nurses staffed will allow for the treatment of more patients at a time and will allow a buffer for any potential nurse sick calls. Additionally, more staff will also help with high acuity patients that may require nurses to lessen their ratios to provide adequate nursing care. To determine the specific number of extra nurses needed per shift, data from previous years should be assessed. The number of sick calls per shift and per week should be considered, as well as the way patient census was trending. This may result in the use of travel nurses or offering interested nurses voluntary overtime. Though the extra staff may be an additional cost to the department, the additional number of patients should outweigh the financial burden. Additionally, offering patients a more pleasant emergency department visit will ultimately result in their loyalty, which contributes to the organization's overall financial security. An additional component of the plan for adequate throughput and the maintenance of satisfactory wait time is collaboration between the emergency department and ancillary staff members. This involves timing the patient's procedures. This planning would likely fall on the primary nurse, but it would require the ancillary departments to be flexible. For example, the nurse can elect to have the CAT scan done before the X-ray because the CAT scan results take longer for the radiologist to read. The new concept would demand open lines of communication with every department that needs to interact with the patient. This would include registration, nursing, the physician, and likely laboratory and radiology, which could include different groups such as CAT scan, X-ray, MRI, ultrasound, and so forth. These groups will all need to work together with the patient's best interest in mind rather than their own schedules and timing. This would likely require a change in mindset for most people. The new concept will need to be communicated to staff by different methods. It could initially be presented in staff meetings, introducing many of the frontline staff to this idea. Follow-up education may occur during pre-shift huddles and will likely also need to occur on a one-to-one basis, ideally in a lifetime situation. The ancillary personnel could be introduced to the idea at their staff meetings as well as receive one-on-one training from their leaders. Additionally, emergency department leaders could check with the ancillary department for additional rationale and support. The leaders of the initiative should emphasize the positive effects of the change, explaining how the change will be beneficial to them. For example, they can share that the change will hopefully result in better staffing ratios, less demanding patient care assignments, and ideally, a less stressful and physically taxing shift for the nurses. Team leaders should be present to answer questions prior to the change and solicit feedback about what frontline staff believe could be barriers. Additionally, the team leaders of the initiative should continue to reinforce and support the concept during rollout and after to ensure the change is sustainable. To evaluate the effectiveness of the strategic plan in practice, monthly data should be compared. A successful implementation would see a decrease in wait time and an increase in patient satisfaction scores after the new strategies were introduced. If times and scores aren't improved, adjustments to the plan should be made to achieve the strategic goal. If the data is favorable, the change should be reinforced and adapted as a new permanent practice. Hopefully, the combination of additional nurses and collaboration with other ancillary staff members will contribute to an easier flu season. Ample staffing and teamwork can greatly contribute to more efficient care that utilizes time and resources to both the patient and staff advantage. Implementing this new practice can help Sharp Memorial Emergency Department achieve their strategic goal of maintaining satisfactory wait times during a high census. Hopefully, this new change will help our department return to Sharp Healthcare's goal of being the best place to work, the best place to practice medicine, and the best place to receive care.